Okay, welcome to Deuk Spine Institute. It is now April 30th, yes, 2024. Our patient travels here from New York. She's here with her daughter. And she's had back pain for how long now? 5 years. And she did a MRI review with me. She has pain coming from multiple locations. Specifically, the disc at L5-S1, in my opinion, the disc at L3-4. She had a fusion done at L4-5. She has pain also from her piriformis muscles on both sides and her facet joints. Shot, AP. Now, she kind of threw us for a little loop. She had a fusion done since we last saw her. And, yep, that's good. You could see the hardware. So this is a patient who had a fusion done in New York, still in pain, as most patients are. They think that these surgeons that put the metal in them are going to fix their problem, but they don't. It just makes it worse. And it makes it harder for me to do my job, which is to get in there and fix their back. All right. Shot. So far, so good. AP. I'm sneaking around her facet joint. The fusion has made my surgery a lot harder, by the way. And without the fusion, I could fix her spine very easily, very safely, very easily. But look at those screws. By the way, if you have a question, feel free to ask your question during this live stream. That's why we do a live stream, so people can ask questions. Otherwise, we just post the videos. Shot? All right. So I'm at the L5-S1. And now we're going to do the L3-4. Yeah, same one. The good news is we're able to access typically 3 discs, sometimes 4 if we're lucky, through one tiny little 7mm incision. 7 millimeters. That's all it takes, folks. She doesn't need... Oh, by the way, Henry, can you see this marking pen? She had a fusion done. I don't know if you guys can see the scar here. Can you see the scar here, Henry?
Yes, we can.
I mean, it's ugly. It goes from here all the way to here. Okay? That's the fusion. Okay, L4-5, she had an L4-5 fusion done in New York. All right, go ahead and put the ruler there, Luis. You can see how big it is. Take this. All right, so the scar she had from her prior surgery is, what is that, 4 inches?
4 inches, yes, sir.
We're going to do this in a 1/4 inch incision. We're going to fix more than she had fixed in New York, and we're going to do it through a smaller incision. All right, so I've got to get up to L3-4 at this point. That's our next target. Any questions?
Yes, we have a question from Royal ViewTube on YouTube.
Hello, Royal. Welcome.
Asking, Doc, what causes thoracic outlet syndrome, and is that something you can fix?
Yeah, great question. Thoracic outlet syndrome is where your nerves coming out of your neck get pinched as they are leaving your neck area. I don't know, for lack of a better word. And, huh? Yeah. The thing that pinches them is typically like a rib or a band of tissue. AP, Coker. A band of scar tissue on the anterior or middle scalene muscle. It's not a common condition, thank God, but it does happen. It's not something I treat, and I have not been trained to treat it. I don't want to start treating it. I treat enough other conditions, but typically you want to see a cardiothoracic surgeon. Cardiothoracic surgeon. That's the kind of doctor that will treat it. Cardiothoracic surgeon. There are probably a few neurosurgeons that do it, And what happens is, like I said, they're going to go in and they're going to unpinch the the nerves. But it's not a common problem, and there's a few tests that can be done to make the diagnosis, AP. One of them is where you check the pulse in the radial artery down low with your arm low at your waist, and then you raise it and you see if the pulse goes away. Like I said, though, I know how to diagnose it. I don't treat it. Great question. And thanks for joining our live stream. So,
Had to go to Missouri, University of Missouri, and there's a surgeon there.
University of Missouri, there's a surgeon there apparently.
Apparently he's one of the best in the world.
Oh, one of the best in the world. University of Missouri. Dr. Davis is chiming in here. All right, we're ready to test her discs. How is she? It's Dr. Deuk. How long have you had your back pain for? How long have you had it for?
Almost 5 years.
Almost 5 years. All right. So she's had it for longer, but it's been really bad for 5 years. She has severe pain right here. This is her piriformis muscle, and that's torn. She has both piriformis muscles torn. Don't worry, these markers actually wash off. Okay? And when you get a tear in your piriformis, it's from bending, twisting the wrong way. It's because you have back pain. You can't bend normally. It hurts your back. So you bend the wrong way and you tear your piriformis muscle. We're going to fix both of these. She also has facet pain.
Yes, sir.
We're going to be fixing her facet pain today at L4-5, L5-S1. So facets on both sides. And the discs. Okay. Are you comfortable? Are you having any pain? No? Good. How bad is that on a scale of 1 to 10? 10? Is that where you get pain? Yeah? All right, good. Is it better now? So she had 10 out of 10 pain at 5-1 concordant from the tear in the back of the disc. How bad is that on a scale of 1 to 10? 10? All right, so L3-4. You get to go to sleep. When you wake up, that pain will be gone. Is that where you get pain normally? Yes? Good. All right. So for those of you watching, this patient's had, she says, 5 years of really bad back pain. She had a fusion done less than a year ago. How long ago was your fusion?
May of last year.
May. So she had it done almost a year ago, and her pain's worse. So she came from New York here with her daughter-in-law to get her pain fixed, which Deuk Spine is able to do because, number one, we diagnosed the right source. Her fusion was here at 4-5. Great. It might have taken the pain away at 4-5. But she has pain at 3-4, pain at 5-1, which they ignored, and the fusion is going to make that pain worse, which it has. She also has pain from her piriformis muscles, which they didn't even diagnose, and her facet joints, which they didn't diagnose. So it all starts with making the right diagnosis. All right, are we ready? So far we've lost like 2 drops of blood, okay? And the beauty of this surgery is that it's relatively bloodless. There's no scar tissue shot. There's no trauma to the internal organs or body during the surgery shot. And because of that, the patients that have this surgery don't need painkillers after surgery. Our patients take a Tylenol in the evening of their surgery, and that's it. They might have a muscle relaxer, and that's all. Okay? The point is, why put yourself through a fusion or an artificial disc surgery which will not fix your problem, number one. It'll make your pain worse in other areas, number two. And the recovery is horribly long and complicated, and you have to take narcotics to recover. Tell me if you need me to slow down. All right. Let's carry on. Can you guys see the tip of the dilator there?
Yes, we can.
It's about to enter the tear. Now, people ask me, Dr. Deuk, aren't you doing damage to the disc when you're doing this? The answer is no, because we're going through the damaged part of the disc. You guys understand what I'm saying? We're not creating new damage. We're going through the part that's already damaged. Shot. Okay, here we go. We're about to enter the 5-1 disc. We're going to fix that first. Now she's asleep, thanks to our awesome anesthesiologist, Dr. Berndes. Shot. Take it out. So we are inside the disc, in the tear, specifically the tear, where the herniation is. That's the source of pain, by the way, for all disc injuries, whether it's a degenerated disc, herniated disc, whatever the disc problem is. Let's pull back and see where we are. Shot. A little bit further. That's good. Whatever the disc injury is, if you have pain from a disc injury, whether it's a degenerated disc, bulging disc, protruding disc, extruded disc, ruptured disc, slipped disc, bulging disc, herniated disc, it's all the same. It's the tear. And Deuk Spine is the first to discover that, myself actually, and we're the first to go in and treat it. We published our first peer-reviewed paper in medical journals about 12 years ago. Actually, yeah, first medical journal publication, but we published our results about 15 years ago at the societies meetings where I presented our results. The American Association of Neurological Surgeons and the Congress of Neurosurgeons. So the surgeons have known about this procedure now for a long time, and yet they continue to do fusions. Why? The answer is simple: money. It's all about money. It's not about what's best for the patient anymore. It's about what's best for the surgeon who's making the decisions. And I'm sorry, folks, but one of the reasons we talk about it is that you guys need to fix that. I can't fix it. All I can do is try to fix people. But you guys are going to have to bring about change by demanding it. Any questions?
Yes, we have a couple questions. This next one coming from Sean on YouTube.
Before we take the question, I apologize, Sean and Henry. Henry, let's show our audience, how is it that this disc injuries cause so much pain in these patients? What is it that causes the pain? Well, from that video, folks, you can see that how a disc injury, how an annular tear can cause so much back pain. So the most common cause of chronic back pain is a disc injury. It accounts for 85% of chronic back pain. This is based on my research that, whoa, we lost the scope. What happened there? Oh, we lost the light. Hold on, I'll get it. Yeah, the light came off. So The second most common cause of back pain is the facet joints, F-A-C-E-T joints, in the back of the spine. They're right behind the disc. As a matter of fact, the nerve root sits between the back of the disc and the front of the facet joint. And the facet joint makes up the back of the neuroforamen, where the nerve comes out. Okay? The disc makes up the front of the neuroforamen. So if you look at the neuroforamen, the top of the neuroforamen is the pedicle, the bottom is the pedicle of the bone below, and in the front, anteriorly we call it, is the disc, and posteriorly is the facet. So the most common cause of chronic back pain I've figured out through studying our patients, and we attempted to publish this at a meeting, but we're going to publish it in a scientific journal, is the disc. 85% of all chronic back pain, the primary cause, number one cause, is a disc injury. And you guys just saw through that video, how does a disc injury cause back pain? And the answer is inflammation. Inflammation is the cause of all pain in our bodies, okay? Aside from an acute fracture or a cut where you're severing nerves, what causes pain in the human body is inflammation. Inflammation is also the reason why we have, thank you, is also the reason why we have coronary artery disease, heart disease. You have inflammation within the arteries of your heart. It causes a blockage called coronary artery disease. So the basis of coronary artery disease is inflammation. What causes the inflammation? Well, it's a buildup of cholesterol and schmutz inside the wall, the tunica media of the arteries, the little arterioles, okay? Point is, inflammation is the cause. Inflammation is the cause of pretty much everything bad. And your inflammatory system is necessary. We all need our inflammatory systems to fight off infections, to fight off foreign invaders like bacteria and viruses and protozoans, and to repair damage in our body. If you have a fracture of your bone, the first thing that happens is your body sends in the inflammatory system to clean it up. Okay, so long story short, we need our inflammatory system, but when it gets a little crazy, it can cause a lot of pain and dysfunction, like this patient right here. It's her disc that's injured, causing most of her back pain. All right, we'll take the question, and then we'll go and show a video on how the Deuk laser disc repair actually fixes the source of inflammation.
Copy that. This next question coming from Sean on YouTube asking, I have had a pinched nerve for 18 years. Is it possible your procedure would not be able to help that? I was told that it may not be fixable.
Sean, our procedure will fix your pain. There's no doubt about it. You can have a pinched nerve for 40 years. We've had patients with 40 years of pain we cured with our procedure at Deuk Spine. We're the only ones that do it. You're going to have to come to Florida, my friend. But before you do that, my advice is this. Use our free MRI review. It costs you nothing but your time. Fill out the form online. Henry will put a link, and send us your MRI or a link to your MRI, and let us look at it and do an interview on Zoom. With that Zoom interview, I should be able to diagnose the source of your pain. Where is that pinched nerve, okay? I know you think you know where it is, but a lot of people are surprised to find the truth, which is that it's actually maybe not a pinched nerve, something else, okay? But it's my job to figure that out. So I don't need you to do that, I need to do it. But I need you to fill out the form, get us your MRI and the report. And we will give you a diagnosis what's causing your pain. More importantly, we can fix it for you, okay? There's no doubt about it in my mind. Doesn't matter how old you are, doesn't matter how bad the disc is degenerated, it doesn't matter anything. All that matters is you get here and we'll fix your pain. Show the video of how the Deuk laser disc repair works,
Copy that.
and then we can take the next questions.
No problem. No
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Okay, and welcome back. You can see from the video that how this procedure works. We basically make a tiny little cut, and we don't damage any of your muscles or soft tissues to get to the spine. There's really no bleeding, no scar tissue. It's an amazing procedure. It's the only one of its kind. And when we get to the source of your pain, we repair the annular tear. We don't repair it, we debride it. And your body then repairs it once we debride it. But your body cannot repair it without me first debriding it. And that debridement is called the Deuk laser disc repair because we pioneered it here at Deuk Spine. I pioneered it. I'm the founder and the pioneer of the procedure. Once the tear is cleaned and you get rid of the herniation and scar tissue and inflammation in that tear, then the tear can heal. But it takes time to heal. It takes about a year to fully heal. And it doesn't mean you have pain for a year. It means you have pain, and usually the pain is gone right away. But the tear will take a year to fully heal, which means you just have to be careful for 1 year and not do too much. All right, shot. At this point, we've placed the guide wire. You got it?
Yes, sir.
And I'm removing the needle. I'm going to slide the dilator. You guys see this? Dilator right here, Henry?
Yes, we do.
Now the dilator is what allows us to get down to the disc without harming the patient's muscles or fascia. What the dilator does is it actually spreads the tissue, spreads it. Kind of like putting a pin in your clothing, like a lapel pin. You're not, shot please, come on Jordan, stay with me. You're not cutting the fibers of your clothing when you put that pin in. You are, shot? Let me see. You are just spreading them apart. Okay, so if you get a magnifying glass when you put a pen through your clothing and you look at it, you'll see that the tip of the pen has pushed the fibers apart and gone between them. That's what we're doing. We're basically using a giant pen here to do that. And so the reason that you can do that with cotton or cloth is that it's fibrous. It's made out of fibers, long strands of material. Well, this patient's muscles are the same way, you know. They're made of these long muscle fibers. Shot? Yeah. And the fibers can be spread apart. That's what we're doing. I think she has some osteopenia as well. You can tell the bone is not normal on the x-ray. The cortex is darker and the diploic bone is lighter on the x-ray, meaning that it's lost some density. Another reason she should not have had that fusion done. Fusions, really you're putting screws in bone that's weak. And so you're asking for trouble by fusing people with, you know, weak bone. But doesn't matter, these surgeons do it anyway because they get paid a lot of money, you know. All right, let's take the questions.
This next question is coming from Roscoe on YouTube,
Hello, Roscoe. Welcome back.
asking what is a ballpark cost estimate for all her procedures today?
Yeah, Roscoe, we don't do that. It all depends. I mean, what we charge and what we actually collect are two different things. But that's true for every doctor, every hospital. What's charged and what's actually paid are two different amounts. So I'm not sure what you're asking, but the truth is that I don't deal with the money anymore, so I don't know. What I would recommend is if you know somebody who needs help, then get the MRI in, do the review, find out what's needed, and then get the pricing based on that. Yeah, sorry I can't give you a better answer, but in a way, we have 75 employees, and some of them do billing and collections. I don't. There's a lot of things I couldn't tell you today about what we're doing, unfortunately. Unfortunately, I've just gotten busy with other things like patient care. Good news is we just a month ago got our patent accepted by the U.S. Patent Office for the Deuk plasma rhizotomy, and we now have it patented. Dr. Davis, who's in the operating room with me, has been performing them on knees and hips with great success, right, Dr. Davis? He actually looked at our patients, and we had over 30 patients with, I think, 95% pain relief was the average, right? For knees? Yeah, so people are able to avoid having their knees replaced now with this new technology that we developed at Deuk Spine Institute called Deuk Plasma Rhizotomy, and that's what's been patented, okay? So if you know somebody with knee pain that has arthritis in their knee, doesn't matter if it's bone on bone, you don't need a replacement done anymore, okay? You should consider the Deuk Plasma Rhizotomy instead. Don't ask me what the cost on that is, but it's a lot cheaper than a knee replacement in terms of quality of life. There's no hospitalization, it's all outpatient. Okay? Outpatient. All right, let me use the grabber again. So we are inside the herniation, and I'll take questions in a moment, but I don't know if you guys could see down there at the bottom of the tube, that's the herniation right there. I'm grabbing it and pulling out pieces with the grabber. Unfortunately, the grabber is not that effective, so you need to use the laser to loosen the pieces up, because what happens is these herniation fragments get stuck to the wall of the annulus where the tear is, and they don't want to come out. So you use the laser to release them. Ugh. This laser fiber, for reference, is half of a millimeter, sorry, it's 1 millimeter wide. Come on. You see all the scar tissue here? That's what this thick white thing is that I'm working on with the laser. And you see the yellow? That's calcification of the scar tissue. That means this has been going on for a long time, many years. You don't get this stuff right here. It's very hard. And this is what pushes on the nerve root, and causes the leg pain or weakness and numbness. This is the herniation. But it's not just a herniation. It's actually a herniation plus calcium plus scar tissue plus inflammatory tissue. And we have all this outlined very nicely on our new website that we're launching soon, hopefully. Unfortunately, we got pushed back because of all kinds of things, but nothing bad. It's all coming together. All right, we'll take some more questions.
Next question coming from Lanu on YouTube. Lanu asking, this may sound futuristic. Maybe in the 25th century, there would be a Deuk pill in which patients can swallow the pill, and the pill would search and vaporize the herniation. Would that be possible?
I love it. Sure. I mean, I'll be honest. I love sci-fi. Anything's possible, right? I mean, after all, we've got robots now and lasers, and man, just when I was a kid in the 70s, all that stuff was futuristic. Phones, right? You all watched Star Trek when you were kids. Remember Star Trek? Where they got on Captain Kirk would get on his, what is that thing?
The Enterprise.
Yeah, the Enterprise is a ship, but what was the thing that he talked to his Enterprise staff with? It looked like a little mobile phone, like a little flip up,
I forgot the name of it, but I know he said
Yeah.
like Captain's Log.
right? And
Yeah.
so he would talk to people through that, and now we have mobile phones. So is there, yeah, absolutely, there's a possibility there will be a pill someday that can do this. And you don't have to have surgery. You just take a couple of pills or a pill. You know, maybe somebody smarter than me is going to come along and figure that out. But I think my greatest contribution is figuring out where the pain comes from. This is our best way of fixing it today. And you're right. The treatment in the future may evolve and get better because this is still surgery, right? There's maybe a better way, less invasive. The important thing is we understand where the pain comes from. And most doctors don't. And that's the problem. That's why we do our broadcast, because people suffer with back pain needlessly, and we want them educated to understand where their pain's coming from. If you talk to doctors today, they all say the same thing. It's non-specific pain. We don't know where it's coming from. Okay? Then you say, well, what about my herniated disc, my degenerated disc? Oh, that everybody has those, but it doesn't cause pain. Well, it does cause pain. It just doesn't cause pain in everybody. All right, next question.
Next question coming from Ping on Facebook,
Hello, Ping.
asking, can this surgery fix neuropathy?
Great question, Ping. So, Ping, I'm going to answer your question very carefully. Here's why. First of all, neuropathy, true neuropathy, is not fixable with surgery. Okay, but true neuropathy is not what most people have. People are given the diagnosis of neuropathy when they don't have it. And it's very important. This is the most important thing I'll say about it. If you're told you have neuropathy and you have pain shooting down your leg, that's not neuropathy, okay? Neuropathy doesn't cause pain to go down your leg. Neuropathy does not cause back pain. Neuropathy causes numbness in your feet or your hands. That's it. Numbness, tingling in your feet or your hands, okay? Neuropathy is a very different thing than a pinched nerve. So when you take my answer, understand that most people are diagnosed by their doctor with neuropathy when they don't have neuropathy. They have radiculopathy or radiculitis. Very different problem, okay? Which is inflammation of the nerve root, radiculitis, or malfunction of the nerve root from compression, which is radiculopathy. My point is simple. Before you go and say, yeah, I guess I can't be fixed by this procedure, get the right diagnosis. If you're 100% certain you have neuropathy, which again is numbness in the feet or hands, sometimes tingling, and you can get like a burning, and that's it. Neuropathy never causes back pain. It never causes neck pain. Ever. So if you have back pain, you don't have neuropathy. You have something else. You may have neuropathy as well, but the neuropathy is not causing the pain. Grabber. Just about done with this disc, maybe 5 minutes, and then we're gonna end the stream, and we're gonna go to the Deuk plasma rhizotomy, which is next, right? And then we're gonna end that stream, and we're gonna go to the piriformis release. The reason we're doing it that way, we have 3 different procedures we're doing on this patient, all during the same surgery, and we really want to make sure that we, when we broadcast it with the proper title and what we're doing. So that looks pretty good. I'll do a little bit more and we're done. So just a few more minutes on this disc. You can see the end of the disc where the pink stuff is at 12 o'clock. Those are veins in the epidural space. This is the end of the tear, the end of the herniation. So we started inside the herniation, inside the tear and herniation, and now we're on the outside of the tear and herniation. And this is the end right here. And it's this part, by the way, that we've been working on. It's very small. To give you an idea, like I said, the glass fiber is 1 millimeter. So we're talking about, 4 or 5 millimeters. Thanks. My point is simple. this work we're doing is in a very, very tactical way in a very small place. So it doesn't destroy your body while we're fixing it. This is the most minimally invasive spine surgery there is. The only thing less invasive is needle procedures, which are not really surgery. They're percutaneous. This is true surgery. It's not percutaneous. All right, just about done. Any other questions?
Yes, we have a couple more questions. These next two questions coming from Sean, once more on YouTube.
Yes, Sean.
First one being, because of the pinched nerve, I have extreme muscle atrophy in my left glute and hip. Once the nerve is unpinched, will that strength come back?
Okay, yeah, so that's definitely a pinched nerve, a nerve problem. And the answer is 50-50 chance of coming back. That's what I tell people. Because that's pretty much what we all of us neurosurgeons will say. There's no guarantee. But number one, with the right surgery, unpinching, you will, number one, not get more atrophy. And number two, you'll give yourself your best chance of recovery. Without surgery, you have 0 chance of recovery, in my opinion, maybe 1% or less, but close to 0. In other words, those things don't just heal on their own. We're done.
Please, thank you.
All right, we're going to end the live stream in a moment. I'll take another question or two, and then we're going to come back with, you can do a little more than that.
More than, okay.
Yeah, that's a little too light.
Next question coming from Sean once more, asking, do you treat hiatal hernias?
No, I don't treat hiatal hernias. Hiatal hernias are treated by general surgeons. A hiatal hernia is where your esophagus and top of your stomach moves up through your diaphragm, and it's treated by gastroenterologists and general surgeons, not by a neurosurgeon. But thank you for your confidence.
And then lastly, from Ping, once more on Facebook, asking, is it worth taking large amounts of collagen to help heal post-procedure?
Yeah, so my answer, it's a great question. You're right. That's exactly what is used for healing by the body is collagen. I would say no. It's not worth taking large amounts. I would just take regular food. All right, bilateral 4551? Huh?
Yes, sir.
Yeah. All right, Jordan, do your best here. Let me have that